Today we're diving into a topic that's been on a lot of people's minds: long COVID, also known as post-COVID conditions or PCC. So grab a seat and let's break it down. First things first, what is long COVID? It's when someone who's had COVID-19 experiences long-term effects from their infection. These can include a variety of symptoms and conditions that stick around, or even show up after the initial illness has passed. You might hear it called different things: post-COVID conditions, long-haul COVID, chronic COVID, and even the fancy term post-acute sequelae of SARS-CoV-2 infection, or PASC. But they all refer to the same idea: lingering symptoms after COVID-19. Here's what you need to know. Long COVID is real and can lead to chronic conditions. It can cause a wide range of health problems lasting weeks, months, or even years. Anyone who's had COVID-19 can develop long COVID, though it's more common in those with severe illness. Vaccinated individuals may have a lower risk of developing long COVID. You can get reinfected with COVID-19, and each infection carries the risk of long COVID. Most people recover from COVID-19 within a few weeks, but for some, long COVID symptoms can start as early as 4 weeks after the initial infection. Diagnosing long COVID isn't straightforward. There's no single test for it. Doctors will look at your health history, symptoms, and any past COVID-19 diagnosis to determine if you have long COVID. The CDC and other health agencies are working hard to understand more about long COVID. For instance, the NIH's Recover Initiative is researching why some people don't fully recover from COVID-19. So, what are the symptoms? They can vary widely and might come and go. Common ones include fatigue, shortness of breath, brain fog, chest pain, headaches, and even changes in taste or smell. If you think you have long COVID, talk to your healthcare provider. They can help you create a management plan to improve your symptoms and quality of life. Preventing long COVID starts with protecting yourself from getting COVID-19 in the first place. Stay up to date with vaccinations, improve ventilation, and practice good hygiene. Living with long COVID can be tough, but there are resources and support available. Stay informed, talk to your doctor, and don't hesitate to seek help. Thanks for watching, and take care of yourselves.